The Health Promotion Seminar Series is a collaborative effort between the Community Health Nurses Initiatives Group and the D'Souza Institute. The seminar offers an opportunity for professional development to nurses working in all domains of practice, community or acute care. For more information on CHNIG, please visit chnig.org. Also, if you'd like to learn more about the D'Souza Institute, please visit the website provided. So our webinar is called the 15-Minute Introductory Guide to Community Health Nursing for Nursing Students and New Graduates. So this webinar, as mentioned, is designed for nursing students and new graduates who are interested in learning more about the opportunities in the field of community health nursing. There are three objectives. One, to increase participants' knowledge and understanding of the practice standards, emerging topics, and professional roles in community health nursing. Two, to build participant proficiency in applying concepts central to community health nursing to a variety of case scenarios. And three, to enable participants to more effectively plan a future career in community health nursing through increased awareness of resources and educational opportunities. My name is Petrina Barbas, and I'm one of the webinar presenters. I'm a third-year nursing student at Ryerson University with an interest in working in community health. May is another webinar speaker who has collaborated on this webinar. She is a consultant with Toronto Public Health, and she also coordinates the Best Practice Spotlight organization. Our agenda is as follows. So we will begin by discussing community health nursing and providing a foundation. We will then move to emerging topics in community health, career profiles, a case study with follow-up facilitation questions and discussion, information about how to build a career in community health with specific focus to continuing education opportunities, and finally, a list of resources. So what is community health nursing? According to the Canadian Community Health Nursing Professional Practice Model, community health nurses support the health and well-being of individuals, families, groups, communities, populations, and systems. Community health nurses practice in health centers, homes, schools, and other community-based settings. Using a capacity-building and strength-based approach, they provide, coordinate, or facilitate direct care and link people to community resources. They view health as a dynamic process of physical, mental, spiritual, and social well-being. Health includes self-determination and a sense of connection to the community. Canadian Community Health Nursing Standards of Practice represent a vision for excellence in community health nursing. The standards apply to community health nurses who work in the areas of practice, education, administration, and research. Standards define the scope and depth of practice by establishing criteria for acceptable nursing practice. They represent the desirable and achievable levels of performance expected of nurses in their practice and provide criteria for measuring actual performance. The 7 standards of practice for CHNs are 1. Health promotion, 2. Prevention and health protection, 3. Health maintenance, restoration, and palliation, 4. Professional relationships, 5. Capacity building, 6. Access and equity, and 7. Professional responsibility and accountability. Some examples of CHNs using these standards in their daily practice include addressing the impact of the determinants of health within the political, cultural, and environmental context, building capacity that focuses on client strengths and client participation, and advocating for healthy public policy to create an environment that's conducive to the health and well-being of all members of the community. So here are a list of topics, emerging topics, issues within the community health nursing field. And so if you just want to take a few moments to read through some of those words and concepts. The constellation of concepts and topics seen on this slide is representative of the work of community health nurses. Many of these concepts interconnect with emerging health and social issues in today's society, such as affordable housing, Syrian refugees arriving to Canada, as well as harm reduction approaches such as supervised injection sites. As you can see here on this slide, there are a variety of roles for nurses in the field of community health. Some of these roles include a community care coordinator, home health nurse, diabetic nurse educator, and public health nurse. Nurses also work in a variety of places. These places include clients' homes, local public health unit, parish communities, an outpatient mental health clinic, school, or local health community center. So next we'll move on to a case study of a fictional patient named Ahmed. As we go through this case study, begin to think of the practice standards, competencies, and values of a community health nurse. Once we complete this study, there will be a series of facilitation questions to guide your critical thinking of the case and its related concepts. Ahmed's story. You're working as a community health nurse in an inner city clinic. Ahmed is a 46-year-old man who steps into your clinic one day. He initially complains about his high blood pressure, but soon reveals some of his other health issues. After spending some time chatting with Ahmed, he mentions to you that he recently moved from one shelter to another because of a recent bedbug infestation. He is currently in the process of finding long-term housing, but is concerned whether he can afford the rent. You begin to ask him about his family when he breaks down into tears, sharing that his wife and children are still living in the Democratic Republic of Congo, where it is rife with political unrest. He voices his worry about their safety and hopes he can sponsor them in the near future. Ahmed is not receiving any social assistance at the moment, nor does he have a health card, because he is a refugee claimant. He confides in you that he is dreading his upcoming hearing. He is having difficulty sleeping at night, waking up several times, shaking, and sweating profusely. He looks to you for support. So here are a list of facilitation questions. This can be done either by yourself as an individual activity or with a group of friends, nursing peers, colleagues, and we've divided them into different sections. Social determinants of health. So think about what are the social determinants of health that are relevant to this scenario. Primary healthcare interventions. As a nurse, what are some interventions within your scope of practice that you could implement to improve Ahmed's health and well-being? Capacity building approach. How can you use a capacity building and strength-based approach in interacting with Ahmed to enhance trust and safety in the therapeutic relationship? Interprofessional collaboration. Think about who, as in individuals, agencies, or resources, that should be involved in the situation described. Health equity lens and social justice advocacy. What population health promotion strategies or interventions could address the broader structural drivers of health and social inequity represented in this case? So moving on to continuing education opportunities, we'll go through a list of opportunities that are relevant to both nursing students as well as new graduates. So some include CNA certification for community health nurses, a variety of resources on the social determinants of health and how to integrate it into your practice, CNA primary care toolkit, a brief overview of RNAO best practice guidelines, as well as resources when working with those who are living with mental health challenges or substance use. CNA certification. The Canadian Nursing Association offers certification in 17 specialty areas. The certification credential is part of the respected National Certification Program. Community health nurses can obtain a CNA certification by successfully passing the rigorous national practice and knowledge requirements of the certification exam. This certificate provides official recognition by nursing colleagues and health system stakeholders. CNA also provides a free e-learning course designed to help you integrate the social determinants of health into your nursing practice. These modules will assist you in recognizing the impact of health inequities among vulnerable populations. If you're interested in learning more, click on the link to access the free course. RNAO also offers a list of resources related to the social determinants of health in the form of brochures, reports, and position statements. To learn more about how the social determinants of health influences your practice and the health of your clients, or if you're interested in getting more involved and speaking out on these health inequities and disparities, follow the link provided. The CNA also provides a primary care toolkit for those who work in primary care settings, such as family practices and walk-in clinics. This tool can be helpful in guiding your primary healthcare practice within a multidisciplinary team. On the CNA website, you can also find the learning module about destigmatizing practices in mental health. This program will give you an opportunity to learn about mental illness from a patient perspective. You'll be guided in a self-reflective process to examine your own beliefs and behaviors while engaging with clients with those who live with mental health challenges. If you are working with clients who use a variety of substances, it is important to utilize evidence-based practices in your approach. The RNAO has developed a best practice guideline on engaging clients who use substances. To access this document for free, you can follow the link provided. As a nursing student or current nursing graduate, you may or may not have heard about RNAO best practice guidelines. As a nursing professional in the future, we are accountable for incorporating evidence-based practices to improve client-centered care and health outcomes. These guidelines span across several practice areas that will support your practice. So you're probably thinking at this moment, where do I go from here in terms of building a successful community health nursing career? If you're thinking of working in community health nursing, there are many things that you can do now, either as a student or a new graduate. Scope out networking opportunities such as workshops, conferences, to meet like-minded peers, potential employers, and nursing leaders. Consider volunteering in the community to demonstrate your willingness to give back, while also developing an understanding of the important role of community belonging to health and well-being. If you are still a nursing student, consider a placement in community, primary, and/or public health. Join professional, public health, and nursing associations to connect with other nurses in the field and learn more about the profession. Finally, locate a mentor or a group of mentors to help you in developing your professional goals. Get involved with RNAO and CHNIG for nursing resources, continuing education opportunities, and networking events. If you're a student, you can join CHNIG for free as an RNAO member. The CHNIG Board of Directors is currently working on developing a new student committee. So stay tuned to learn more about this upcoming nursing student leadership initiative. If you've not already done so, check out our website to stay up to date on community health related news and events. We're also on Facebook, Twitter, and Instagram. Finally, here's a list of useful links and additional resources you can use in your future practice as a community health nurse or even now as a nursing student while in placement. The Public Health Agency of Canada is focused on effective efforts to prevent chronic diseases like cancer and heart disease, prevent injuries, and respond to public health emergencies and infectious disease outbreaks. There's a link to their Skills Online program, which is a free continuing education program that helps build the skills and knowledge you need to meet the core competencies for public health. CH Networks is a network that links researchers, decision makers, and practitioners in population health and stakeholder sectors from across Canada. CH Networks hosts weekly fireside chats or webinars sharing leading-edge research and application, supporting discussion and actions on pressing population health issues. The Community Health Nurses of Canada is a national body and voice that represents community health nurses and the health of communities. The links provided here connects you to the standards of practice, competencies, and continuing education. The 6 national collaborating centers for public health promote and improve the use of scientific research and other knowledge to strengthen public health practices and policies in Canada. Check out their newsletter, resources, projects, and events. So thank you for listening to our webinar on an introductory guide to community health nursing. If you have any questions, please feel free to reach out to myself or May, and we'd be happy to answer your inquiries. All the best in your future nursing endeavors in community health.